The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Now, tell me about the surgery experience, like meeting the patient, doing the surgery, whether you had an assistant or you were assisting or a combination of both.
So I thought they set it up very thoughtfully. I was operating in conjunction with a Costa Rican surgeon. So he had sent me in advance her images, her wishes, kind of about like the aesthetic that she was going for. And obviously I am no longer in Costa Rica, so he's providing all of her post-operative care. But they had a beautiful state-of-the-art operating room with actually a U.S. American anesthesiologist that now lives in Costa Rica. So I got to meet him too in advance, and then a big viewing gallery where the other surgeons were, and they mic you up and have everything ready so that you can communicate with the observership deck. So I got to meet the patient in the morning, kind of go over everything. Clearly there's unlimited implants available, so we could choose anything that we wanted and didn't have to worry about having to place an order. And just got a good feel for her, and then saw her afterwards in recovery. And then I got some follow-up photos about a week later, and the assurance that she's really thrilled. So it was a really, really great experience, and nice to use the implants in hand, because then that was a Saturday. Sunday I went back to Houston, and then Monday was my first US case. So it was like helpful to kind of just get a feel for the technology and how it may handle a little differently, and talk to the international surgeons that were there.
That's awesome. And then for this specific case, did you use the Mia Femtech approach, which is the axillary incision and I believe subglandular under the skin approach?
So that technology, they said it has been launched in certain countries, obviously not the United States, but they had one of their surgeons demonstrate it. And it was very, very cool. They basically have this entirely closed system where they have, you think about how we place implants through a funnel. So they had kind of like a firm one that you use suction to suck the implant up. So this is now the 7th generation gel, so squishy, so flexible that it could actually suck it up into the funnel. And then you just bluntly create a little pocket through the armpit, and then you just deploy it and it just pops in. I mean, it was incredible. I did a traditional approach through the inframammary fold, so that kind of how I would do a breast augmentation in the US, but we got to see how that Mia Femtech is how it works. And, it was really impressive, the design of the implant too, for something that is like relatively small volume. It packed a pretty good punch in terms of like how it presented itself in the implant, because of how they designed the implants to have that like diamond edge. So there's a little bit more projection with smaller volume. So it was really cool. I mean, their thought is that this becomes like it's still absolutely surgery, and they want board certified plastic surgeons doing it, because you still need to know the anatomy, done under local, done more in a procedure room as opposed to an operating room. And then almost no recovery, no incisions on the breast, and it's pretty neat.
That's awesome.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty, and connect with Dr. Hamilton and Dr. Kim.